Chapter 10. GHB. A few key facts. GHB is a synthetic substance found in liquid or powder form. It's a depressant. Its popularity is unclear, as not much data has been collected, although what is available suggests it's not overly common, even among people who use other drugs. It's usually mixed into a liquid, although not alcohol, and drunk. Some effects include euphoria, relaxation, disorientation, and drowsiness. The press in the UK refer to it as liquid ecstasy, and it's been linked to date rapes, club culture, gay culture, and bodybuilding. More recently, it's being portrayed as a drug popular with young women who want to go out dancing, who might be concerned about the calories contained in alcohol and are looking for a substance with a similar intoxication effect without the sugar content. But headlines in the press also warn of its ability to melt plastic and the high risk of overdose from it. What is it? GHB, or to give it its chemical name, gamma-hydroxybutyric acid, is a depressant, made in small quantities by the human body. Closely related to GHB are GBL, gamma-butyrolactone, and 1,4-butanediol, GHB prodrugs or precursors that the body converts into GHB when they're consumed. All these substances are usually encountered in a powder or colourless and odourless liquid form, which can be added to beverages and drunk. While GHB is often a controlled substance, GBL and 1,4-BD are found in some cleaning products, meaning they are potentially easier to get hold of. In Australia, GHB is often referred to as G or juice. What are the short-term effects? Many people who use GHB report doing so because of its similarity in terms of intoxication effect to alcohol. If a person takes GHB, they will experience onset of intoxication within about 15 minutes, and this will then last for a couple of hours. GHB can make people feel chilled out, make them feel euphoric, and some people report feeling sexually aroused or horny when intoxicated. However, although it's thought of as a sex drug, intoxication on GHB can also make it harder for men to ejaculate. Similarly to alcohol, GHB can lower inhibition, which can lead to an increased risk of partaking in unsafe sex, and because of that, an increased possibility of contracting an STD, or even of having sex with someone you wouldn't normally have sex with. At higher doses, GHB can make a person feel dizzy or confused. It can increase feelings of disorientation, and can make people feel drowsy. It's not uncommon for people using GHB for the first time to vomit, and high doses can also induce vomiting, much like alcohol. GHB can cause stiffening of the muscles, which can make movement harder. People report twitching, dribbling, and finding themselves unable to sit or stand up straight. At higher doses still, GHB can cause people to pass out and can induce respiratory collapse. At these levels, there is the risk of seizures, coma, and even death. When people are having a night out and using GHB multiple times, there are further dangers. Due to the impact of GHB on short-term memory, it's easy to forget how much you've taken and when. As such, people will often set themselves reminders on their smartphones so they know not to take any more GHB for at least a couple of hours. Anecdotal evidence also suggests that the more doses a person consumes on a particular evening or session, the higher the chances of them passing out or experiencing bad effects from doing so, although this is possibly due to the increased likelihood to misjudge either the individual dose or the time between doses. GHB is a particularly dangerous substance to take when you're alone, in case you need an ambulance or help after an accidental overdose. People who regularly use GHB report that losing consciousness, while not being something they ever intend to do, does happen, and when it does, they are reliant on friends taking care of them. Should you find yourself in this situation with someone who has passed out, the advice is to put them in the recovery position on their side and keep checking their breathing. If it slows, call an ambulance immediately. What is it about GHB that is particularly risky in this regard? As well as it impacting on memory and judgment, and maybe making intoxicated people more likely to take a dose sooner than they should, the doses involved are extremely small, which is problematic for a couple of reasons. If a person is using a syringe to measure their dose, this might get harder as they get more intoxicated throughout the evening, meaning that errors are more likely. Because the dose is so small, a small increase could have big consequences. As an aside, people will often put a pen mark on a syringe so they know where to fill the syringe up to. However, GHB can dissolve the ink, often resulting in the pen mark becoming faded or disappearing over time, possibly as intoxication is increasing too, a bad combo. More perilous still, GHB has what is known as a small window of efficacy. By this, I mean that there is only a very small difference in dose between an amount that will give an effect a person desires and the amount that will push them into toxicity and lead to extremely negative effects. This problem is compounded by the illicit nature of the substance. It's likely that different batches of GHB will be differing strengths, meaning that a dose from one batch, despite being the same volume of liquid, could be far stronger and therefore extremely dangerous. It's really hazardous to add these substances to alcohol, as the depressant effects of each will be emphasised, and the risks from consuming too much are therefore higher. Not only that, but because the dosage is very small, when people administer it into their drinks using a syringe, a difference of millimetres can impact whether the dose is enjoyable or enough to induce unconsciousness. And GHB and GBL have differing dosing, so this can also be problematic for people using the substance. There are other analogues of GHB too, including substances like 1,4-butanediol, which also have different dosages and can lead to dangers. Much like many other substances in this book, GHB is particularly risky to people who have underlying health problems related to their blood pressure, either low or high. It's also thought to be unsafe for people who have epilepsy or a history of convulsions, and to people with pre-existing heart or breathing problems. GHB is also harmful if consumed neat rather than mixed into a drink. It can cause damage to the mouth, teeth, throat and stomach if consumed in this way. What are the longer-term effects? Longer term, there's some suggestion that people become tolerant to GHB, needing higher doses to get the same effect. There's also growing evidence that GHB can lead to psychological and physical dependence. Warning signs for dependence can include motivation or reasons for using. If individuals are using GHB to cope, for example to manage symptoms of trauma or poor mental health, to aid with sleeping or to numb painful feelings, or are using it alone rather than in social settings, this may be an indicator that a person is becoming reliant on it. Clinics that work with individuals dependent on GHB see some people who are using the substance multiple times throughout the day, and even waking up during the night to take GHB in order to avoid withdrawal symptoms. Those people trying to stop using the substance report withdrawal symptoms that include delirium, psychosis, tremors, insomnia, and severe anxiety. Due to this, it is strongly advised that individuals who want to stop using it should seek medical support. Trying to reduce or stop using GHB without medical support is extremely risky, as seizures can also occur as part of withdrawal, and individuals may need hospitalisation for treatment. Withdrawals can be particularly complex if individuals are using GHB in combination with other substances. More on this later. Myths and misconceptions. GHB is a gay drug. GHB has a reputation in the media for being a drug used particularly by homosexual men, as a club drug, a chill-out substance, and something used during sex to enhance the experience. Actually, there have been very few large-scale surveys of who uses GHB, so this may not present the whole picture. The Global Drug Survey, which takes place every year, uses opportunistic sampling. They ask people to take part and to share the survey among friends, rather than trying to recruit a random and therefore representative sample. As such, it's not a good way to work out what the prevalence of use of a substance is in the general population, as people are far more likely to fill it in if they use drugs than if they don't, because of the nature of the survey. However, it can give a good indication of how commonly used a particular substance is among people who use drugs in general, and it can also give an idea of what groups of people might be particularly likely to use a particular substance. In their 2018 report, the Global Drug Survey noted that use of GHB is low, even among a sample of individuals where drug use is overrepresented. They reported that GHB was used by 1.4% of straight men who filled in their survey, 4.4% of homosexual men, 0.8% of straight women, and 1.9% of gay or bisexual women in the previous year. They don't report about bisexual men for some reason, presumably they are included in the category for homosexual men, as is the case for women. However, while this might look like it's predominantly used by gay men, the number of people in each group is important. They point out that there are more straight men than gay men who filled out the survey, and as such in absolute numbers, the largest group reporting using GHB were straight men. Not only that, but their report also found that those gay men who were using GHB were doing so infrequently, roughly 16 times a year, which led them to conclude that the stereotype of dependent users is also challenged. However, Other research suggests dependence on GHB might be on the rise, certainly in Australia where research is taking place. Addiction researcher Dr. Shalini Arunagiri works with individuals who use GHB in Melbourne, Australia. She told me she is seeing an increase in dependent users where she works, and that this pattern is also being seen in the UK and across Europe. Other studies have found that despite its reputation as a club drug, GHB is most commonly consumed in private residences rather than in these settings. This might suggest that rather than a club drug, it's a post-club drug. But in reality, we know very little about who is using GHB and how, and also very little about who is likely to develop problems or experience harms from doing so. So it's a myth. GHB is a sex attack drug. There have been cases where GHB has been implicated as a date rape drug. The substance can make an individual feel out of it and even fall unconscious, and it has been linked to sexual assault and rape of both women and men. However, while being vigilant with your drink when you're out is always a good idea, is there any truth to GHB being used in this way? A 2006 study by the Association of Chief Police Officers suggests maybe not. They found that of 120 instances of alleged drug-facilitated sexual assaults, in only 2 cases was GHB found to be the substance used. A systematic review on this topic was conducted in 2010. The authors of this research found very few studies that had assessed the use of GHB in drug-facilitated sexual assaults of women. In what few studies they identified, they found rates of positive screening for GHB at around 4% in the USA, less than 1% in the UK, and a similar rate in France, the only 3 locations where data was available. However, they also point out that screening for GHB in these cases has only been introduced relatively recently. Not only that, but given the large percentage of sexual assaults that go unreported and the short half-life of GHB in the body, meaning a delay in screening might miss its use, they suggest true rates might be higher than their results indicate. GHB is also naturally found in low levels in the human body, in various different bodily fluids and tissues, including blood and urine. It's not really clear why, but GHB appears to be related to the naturally occurring neurotransmitter GABA. This presence of naturally occurring GHB can make it even more challenging for police to determine whether low levels of GHB found are due to a drink being spiked or simply naturally occurring GHB produced within the body. So this is unclear, possibly partly true. GHB helps bodybuilders bulk up. Research into GHB has noted that it increases slow-wave sleep as opposed to REM sleep. During slow-wave sleep, a growth hormone is secreted into the body. Because of this, GHB was popular with bodybuilders during the 1990s, and more recently, as they believed it could help them bulk up. However, the evidence that GHB actually leads to measurable differences in body mass is extremely thin on the ground, and some experts suggest that levels of growth hormone might only increase for very brief amounts of time after taking it, meaning it's probably not a sensible strategy to employ for individuals looking to gain muscle. So it's probably a myth. Does GHB have any medical uses? GHB is available as a medication in the USA, although it's rarely prescribed. In the past, it was used as a pre-medication to help patients sleep prior to surgery. It's also prescribed for the treatment of narcolepsy, a rare condition where the brain is unable to regulate sleep patterns, meaning people can fall asleep at inappropriate moments. GHB is the active compound in the branded medication Xyrem, which is prescribed for cataplexy, sudden weakness in muscles caused by strong emotions such as laughter, anger, or surprise, and what's termed excessive daytime sleepiness. There is also some history of GHB being used to help people undergoing withdrawal from dependent alcohol use, although there are more effective medications for this, so it's rarely used in this way. Although not recognised as a treatment, GHB is also very occasionally prescribed off-label for the treatment of fibromyalgia, a poorly understood condition that causes pain throughout the body and a heightened pain response. GHB and other drugs. I've already mentioned that GHB is particularly risky if mixed with alcohol. Unfortunately, co-use with alcohol is common, as the drug is taken where people are socialising, which often goes hand in hand with alcohol consumption. But GHB is also more dangerous if co-used with stimulants. Some people might use a stimulant such as amphetamine, cocaine, or even a caffeinated energy drink in order to stay awake for longer while intoxicated on GHB. But stimulants can mask the effects of GHB, which can then result in accidental overdose as the margins of too little to too much for GHB are so small. Some individuals use GHB to manage the come down or withdrawal from stimulants such as methamphetamine. This co-use is risky as dependence can then form to both substances. Not only that, but treatment clinics report that withdrawal from GHB can be more complicated and unpleasant, not to mention dangerous, where individuals are also using stimulants like methamphetamine.